Good day, dear students. Today our lecture's topic is medicine in Kyrgyzstan. Our plan: first, stages of medicine development in Kyrgyzstan. Second, healing in Kyrgyzstan till 1863. Third, history of scientific medicine. And fourth, medicine of the sovereign Kyrgyz Republic. Stages of medicine development in Kyrgyzstan. Before the reunification of Kyrgyzstan with Russia till 1863. During the Russian Empire from 1863 to 1917, Soviet period from 1917 to 1991, and medicine of the sovereign Kyrgyz Republic since 1991. Before the reunification of Kyrgyzstan with Russia, it was tabibs, which include tamurche, pulsators, sınıkçı, chiropractic, general profile, and midwives. Representatives of religious medicine: mullahs, shamans, duvana, and bakhshi. During the Russian Empire. After joining Russia and Kyrgyzstan appeared doctors, paramedics, dispensaries, hospitals, pharmacies. Hospitals in the military units of the Tsarist army stationed in Pishbek, Osh, Przhevalsk, and Naren. Since 1885, hospitals founded in Osh, Pishbek, and Przhevalsk. In 1908, a paramedic facility established in Pishbek. In 1911, a resettlement hospital founded. During the Russian Empire. On the eve of the October Revolution in Kyrgyzstan, there were 7 hospitals with 100 beds, 15 doctors, and 25 paramedic points. State of health of the population was poor. People suffered from smallpox, plague, cholera, and trachoma. First doctors were Vyshplovsky, Bespalets, Kluchevsky, Barsukov, Payarkov, Frunze, and paramedics Shelenin and Frunze. Soviet period. In the first years of Soviet power in Kyrgyzstan, there was a collapse. There was an epidemic of cholera, typhus, and measures were taken to combat them. Isolation wards were built, disinfection chambers, mobile medical and epidemiological units worked. Sanitary cleaning of settlements, sanitary education among the population was carried out. Health authorities were established. First Commissar of Health of Pishbek country was Ivanitsyn. Sanitary inspection and sanitary police worked. The epidemic was eradicated by 1923. Kyrgyz Autonomous Province. Measures: improvement of public health, medical facilities building, including specialized maternity hospitals, children's hospitals, venerological outpatient clinics, and dispensaries. 2 medical examination units worked, also engaged in health promotion. Kyrgyz population suffered from skin diseases, scabies, sexually transmitted, syphilis, and eye diseases, trachoma. In rural areas, medical and mobile units worked. In 1927, the People's Commissariat of Health was founded. Medical mobile units continued to work, including specialized medical teams for eye diseases. Medical health centers at large industrial enterprises, meat processing plant, interhelpo factory, laser factory, printing house, clothing factory, mines founded. Institutions of the Sanitary Epidemiological Service were founded. In 1928, medical school was founded in Frunze city. Since 1928, the Against Especially Dangerous Infections Control was organized. Developed a sanatorium health resort service. In 1936, smallpox was eradicated. Doctors of Kyrgyz nationality: Egemberdiyev, Malyshev, Shamiev, Akhumbayev, Sadykhov. The pre-war years. Improving the quality of medical service increased the number of beds by building new hospitals. In 1938, the first research institute of hygiene, epidemiology, and microbiology was founded. Issue of the medical journal. In 1938, the neuropsychiatric department opened in Frunze and the Chimkorgon Republican Psychiatric Hospital. The capacity of rural hospitals has increased. In 1938, the Kyrgyz State Medical Institute was opened. Medical vocational schools in Karakol, Jalalabad, Osh and Tokmok. Years of the Second World War. Healthcare tasks. Provide medical assistance to the evacuated, the injured. Prevent epidemics. Preserve the sanitary well-being of the country. Establish the production of medicines, disinfections. Solve these problems, new medical facilities, hospitals were organized. At the beginning of the war, students of Kharkov, Kiev, Moscow, and other medical universities were transferred to KSMI. First graduation of Kyrgyz State Medical Institute took place in 1942. Post-war years. Health authorities measures to improve the quality of medical care, healthcare culture, for advanced training of doctors and nurses. A systematic organization of public health services in all sectors of the economy was launched. Medical facilities were built, including maternity hospitals, children's hospitals, pharmacies, and kindergartens were opened. In 1948, the unification of outpatient clinics and polyclinics with hospitals began, the united hospitals were formed, and the precinct service principle appeared. Years of peaceful development. Medical facilities continued to open in the Republic. All kinds of specialized assistance are deployed. Typhus is eliminated. Trachoma and skin venereal diseases have decreased. Medical science is developing rapidly. Medicine of the sovereign Kyrgyz Republic. During the years of the sovereignty of the Republic, in connection with the collapse of the USSR and the disruption of communication in the national economy, the socio-economic situation worsened. The health care of the population has worsened. The state of health of the population was worsened. The state is taking measures to improve public health. The first laws of Sovereign Republic on health protection were adopted. First health laws. On the protection of the health of the people in the Kyrgyz Republic, and compulsory medical insurance of citizens in the Kyrgyz Republic, on the sanitary and epidemiological well-being of the population of the Kyrgyz Republic, on blood donation and blood components. Thank you for listening.